I see our attendee numbers are growing rapidly. We are over 430 participants so far. And while I have been on a lot of Zoom meetings in the past couple of weeks, I certainly have not been on one this large. This is very exciting. And, you know, normally this time of year, we would all be at the Corey Convention Center for the National Smart Start Conference. Unfortunately, cannot be in the same room together, but I am so thrilled that so many of us can virtually be together. So good morning, all. My name is Heather Strickland. I am the Fund Development and Communications Director for the Smart Start Network. And normally I oversee the national conference planning, but this year we're doing it a little bit differently. This is the one featured session that we were able to offer this year. And so far it is by far the largest attended featured session we've ever had at a Smart Start conference, at least since I've been doing it. We're now quickly approaching 500 attendees on a Zoom meeting. So many of you will notice that you do not have the usual controls that you might have in a Zoom meeting. That is because with this many attendees, we had to make sure that everyone stayed muted, and also you will not be able to use your videos either. And that's just to help us control bandwidth as well as the amount of noise that is coming into the featured session. The chat box is active. There is also a Q&A button at the bottom of your screen, and we will be using those throughout. And before I turn it over to our panelists, I'm going to quickly ask the Smart Start Interim President, Donna White, to just say a few words of welcome for everyone. Donna?
Thank you, Heather. Good morning, everyone. You know, as Heather mentioned, we've been overwhelmed by the interest in this webinar and had to update our upgrade our Zoom account just a couple of days ago. And I want to thank Heather Strickland and her team, and Scott Lauder, our IT director, and his team, who so quickly and with so much grace have pivoted to make this possible. And appreciate the panelists taking time out of your schedule during this really busy time, and also all of you who are joining us today. You know, I don't even know who all is on the call with us. However, I do know that given that you're in the early childhood field, that you are extremely dedicated and you are working hard to support families and early childhood professionals during this pandemic. And thank you for all that you're doing. And please, let's all remember, as we're working, to keep lifting our heads, lifting our vision, to reflect on and capture what's working well right now, what's not, and where we need to focus as a field to build a more resilient early childhood system over time as we move forward. Whether you're in communities or in state organizations or in national organizations, it's going to require all of us sharing our knowledge, our experience, and lifting our voices with courage for a future where the earliest years are prioritized, as if our society's future depends on it, because it does. Thank you again for being here. Back to you, Heather.
Thank you, Donna, so much. All right, so for those of you that are just joining us, just be aware that we have turned off the video and audio for all attendees. We are now over 550 people on this Zoom call for this virtual Smart Start conference this morning. So thank you all so much for joining us. There is a chat feature, and there also is a Q&A feature, so we will be using those. There is a whole team of folks behind the scenes making sure that your questions get answered as fast as possible. So with that, I am going to turn it over to our moderator for today, my friend and my colleague, Scarlett Bouder. Scarlett, I'm handing over 560 people to you.
Thanks, Heather, and thanks, Donna, and thank you to the panel, Nasha, Joy, and Donna. I've been fortunate enough to work with each of these outstanding women leaders that have lifted up, as Donna said, the importance and the prioritization and the passion and the commitment and the my head is not going to lean down, I'm going to lean in and push forward and up. So I'm just excited to have this discussion with all of you who are listening and with all of these tremendous women. Just a few housekeeping things on approach. We'll start off by asking a few foundational questions, just getting a sense of who these panelists are, what their work entails in the childcare space, just sort of to set the stage. But the majority of this conversation, what we want to have is the exchange with you all, because it's what we would have done if we were in person at the Corey Center. So I'm asking we've asked the Smart Start team to vet the questions that are coming in. So as a result, I have two requests, one of those who are listening and one for the panelists. The one for the listeners is that, as Heather mentioned, the chat box is your friend. Don't wait until towards the end of the discussion to throw your questions our way, because we want to be nimble. We will be nimble to make sure that this discussion is relevant to you. We want you to walk away from this discussion thinking, hey, that was a good use of my time. So we will shift and pivot based on what comes through in the chat box. And I know, much to the chagrin, I'm sorry, I'm glad I don't see Heather's face. About every 10 minutes, I'm gonna pivot back to her and the IT team to say, what are people asking? What are people expressing? And then we'll return and pivot back to the panel to make sure that we're being responsive to what you need to hear on this discussion. For the panelists, as Heather said, we've all been on a lot of Zoom calls, conference calls lately, some big, some small, everything in the middle. And I think what our firm has observed from many of those, it's a lot of talking at you and telling you this is what you have to do. But the gap is, well, how do I do it? And I know that everyone on this panel can speak to both of those in their sleep when it comes to the work that they do. Not only what we should be doing on behalf of children and families and communities, but how are we doing it? We want you to walk away with substantive action steps that you can return to your community and say, hey, this is what I'm hearing about what's being done, but more importantly, how it's being done, knowing that each community has to cover this landscape in their own way, because it's very much uncharted, as I know we've heard many, many times. So the last thing I'll say before we go into introductions is really lifting up what Donna said about grace, and I'll add something to that around hope and grace, that we are preparing for the worst, but hoping for the best, and inserting grace into everything that we do. So just know that this is a panel that exudes that in all that they do, and I hope you hear that in the discussion today. So with that, I'd like to ask each panelist, and I'll sort of identify so we don't have to worry about talking over one another, is to introduce themselves and talk about their role in the early childhood or childcare space. And then if you can also just talk about what the landscape looks like in your region or in your state. And I'm going to start that with Director Joy Bivens of Franklin County Job and Family Services. Joy.
Thank you, and thank you so much to this wonderful organization. I look forward to coming every year. I learn so much, and I've met some really wonderful people working with this organization over the last several years, and I just appreciate all the providers and all the work that everyone does across the country on behalf of our young people. So I am Joy Bivens. I'm the Director of Franklin County Department of Job and Family Services. My role, my professional role, I oversee the administration of public assistance benefits for the entire county. So our role is to administer food assistance, cash assistance, Medicaid, workforce programs, and we also do contracting as well as oversee the publicly funded child care program for our county. Our county is the largest county in the state of Ohio. We have 1.3 million residents. When you talk about the landscape of Franklin County, currently right now, well, pre-COVID, we had 850 providers home. That's a combination of home and centers that were providing childcare service. Quality childcare services to our families. 630 of those families were receiving publicly funded childcare services. So they were receiving the substance. I think that, you know, again, pre-COVID, we were on a trajectory to ensure that all of our childcare, our early learning centers within Franklin County became stepped up to quality, which is the the quality system. However, since the pandemic, we've kind of paused on that from the guidance of the state in order to, you know, educate and move our providers forward for going forward. And that date, I believe, our first date was July 1st, 2020, that every center in Franklin County had to be star rated. Now, I believe that date has moved back to September, but what I'm hearing is they're still requiring every center home that is home and center based to be star rated. So pretty much that's the breakdown right now. We have about 250 pandemic centers that are open. So centers had to apply in order to be a pandemic center from the state. Normally, parents come to us to apply for their subsidy. The way that the state is doing it in Ohio, they go directly to the state. Those 250 centers are designated again by the state, and they deem those centers and those workers essential in order to use those services in the county.
Thanks,
Did I touch on everything, Scarlett?
Yeah, we'll dive a little deeper in it. Thank you.
All right, thanks.
Hey, can you hear me?
Yep.
Hey, hi everybody, and thanks so much for joining and for giving me the opportunity to speak about my work and really my team's work. I am the Deputy Assistant Superintendent of Early Childhood and Early Elementary Strategy in Louisiana. That means I work for the Department of Education in the Office of Early Childhood, and I lead a team that thinks comprehensively about access to and quality of childcare, Head Start, public and non-public pre-K that take public funds to serve young children, as well as the experiences that they're having in K-2 and how we can make sure to sort of build on the early childhood work that we're doing into the K-2 space. So I don't directly administer childcare assistance, but I do work very closely with the team that does, and we collaborate and work very closely to make sure that our teams are essentially building towards opportunities for families that meet their needs and are of the highest quality that they can be. In this pandemic, we have obviously, as others have, lost care. We typically have about 1,300 licensed childcare centers, about 1,000 of which accept childcare assistance, or actually about like 800 of which accept childcare assistance. And we are currently at about 70% of those centers closed due to the pandemic, though we have started to see centers reopen and are thinking very, very carefully about how we support centers to reopen safely, how we make sure that they can do so while keeping their children and their families and their staff and themselves safe and healthy along the way. We do administer the quality rating system for our programs, because we're a unified state. We have a unified quality rating system for childcare, Head Start, public and non-public pre-K. Basically, anyone who takes public funds participates in our quality rating system, and it's based on the class. So we are looking at the quality of adult child interactions multiple times throughout the year and developing a rating based on that. So it's mandatory for anybody who takes public funds to participate, and we continue to work every day to make sure that quality continues to improve. We know that as a result of this pandemic, we're going to have to really think about how we can support teachers, directors, and staff in centers to go back to the level of quality they were at. I think there's a lot of sort of trauma, concern, shifting of children, things that will contribute to different qualities of environments, of interactions, of staff being able to sort of support children in the best way possible. But we're hopeful that we can leverage the foundation we've built with the class tool to continue to sort of move forward in terms of improving access to quality for young children. Scarlett, did I miss anything?
No, I think you're good.
Great.
Like I said, we'll dive a little deeper in a minute. Thanks, Nasha. Donna.
Good morning again, Donna White. I'm the interim president of the North Carolina Partnership for Children, and we lead and support the statewide Smart Start Network in North Carolina that was developed 27 years ago by our legislature as a public and private partnership network of community-based organizations working across the state to improve community early childhood systems and ensure that children were prepared for success and in life. And normally the Smart Start system provides a great deal of technical assistance, primarily around improving quality in child care centers, helping with professional development, teachers going back and getting more education. Definitely during this pandemic, our assistance has shifted to much more basic needs, just as the support for families has shifted to basic needs while focusing on parenting support. Our support for child care centers has also shifted to basic needs. Health and safety is the paramount focus right now. We also have lost many child care centers. We have roughly 57% that are currently operating in our state, and a larger percentage of our licensed family homes remained open than the centers. And with the 57% that are currently operating as emergency centers, they also did need to reapply to remain open. They are the data shows that the closures are impacting us statewide, and the Budget and Tax Center in the North Carolina Justice Center has done a county by county analysis of the impact of the closures in our centers in our county and the trends that they are able to demonstrate. And this is looking at mid-April data because it changes daily. The landscape is continuing to change, to be very dynamic. In North Carolina, we have 100 counties. So we have a lot of counties. 40 of our counties saw more than half of their child care centers close. And 9 of our rural counties had more than 80% of their child care centers closed. And in counties where more than 50% of young children live in child care deserts, the average closure rate was 47%. So in those areas where child care was already scarce, they were especially hard hit. We are a state where our QRIS is integrated with our licensing system. Several of our regulations and requirements were relaxed for the emergency centers, and we are now on schedule to this Friday on the 8th of May to begin what our governor is calling phase 1 of a gradual reopening, and with retail being able to open. And so we're anticipating that more families will be going back to work and will be needing care. So our Department of Health and Human Services is in the process now of working on new guidance for new centers that will also need to apply to reopen.
Thanks, Donna. And I'm going to start with you as I circle back through the panel on that last point. So everyone, each of you, and I want everyone to know that we chose the panelists here for a reason, because each state, Louisiana, Ohio, North Carolina, are in different places on the continuum of quarantining, partial reopen. So we wanted to give you a diversity of perspective on the context, on the world that we're living in. So Donna, we know each panelist understands their landscape very well. How, and I know things are still evolving, but how are you seeing the state of North Carolina respond to assisting childcare providers in the reopening, in this new normal, because it's never going to be what it was 6 months ago. So how are you, what's your observation on how they're responding to that reopening strategy?
I would, in North Carolina, I feel like we are working hard to collectively put our arms around the childcare system with limited resources. Our Department of Health and Human Services has done an excellent job to quickly set up guidelines for emergency programs, a 1-800 number to match essential workers to childcare that's administered through our Childcare Resource and Referral Network. Smart Start and DHHS partnered to deploy childcare health consultants who were serving previously about half of the counties in North Carolina to assure that every open center would have consultation remotely from a childcare health consultant, which is, that kind of consultation is so critical right now. The shortage of cleaning supplies and personal protective equipment has been extremely challenging, and the Smart Start local partnerships in every county are serving essentially as brokers to help childcare centers find and access these supplies. And that's everything from negotiating with retailers to set supplies aside, allow them to buy more food than normal shoppers can buy at one time, to raising funds and getting donations and then setting up safe distribution points for centers. DHHS is providing subsidy payments for April and May to centers whether they're open or closed. And also they're paying for the parent co-pays. And our NC pre-K centers also are receiving payments through this school year, whether they're open or closed. And essential workers who are at 300% or lower income level are eligible for subsidized support during this pandemic. And the childcare centers are not having to verify their income for them to enroll. So really trying to make it as easy as possible. And the piece that we are so grateful and excited about that our state agency has done is they're providing significant bonus pay for staff in open centers, $950 per month additional bonus for teaching staff, and $525 additional for non-teaching staff. And they also are providing an additional 10% on top of the bonuses to cover the payroll taxes and other administrative costs. Last Saturday, our legislature appropriated $19 million to be split among several human services supports, including childcare. So we don't yet know how much of that funding will be directed to childcare. It's so much less than than the need is. Our legislature does plan to come back in session in a couple of weeks, so we're hopeful that there'll be more funding that can be appropriated then. They have not yet appropriated all of the federal funding from the CARES Act. And the legislature also included our child care providers among the groups to be prioritized for access to testing supplies and personal protective equipment. And
they have prioritized essential child care.
That just happened on Saturday. And the other thing that has bing both challenging and everyone's been putting so much effort into it is the communication. Things are changing fast, and DHHS has been regularly sending out updates very broadly, and they've held a couple of webinars with childcare centers, with directors. There's been a governor's task force on education and nutrition that met weekly and is now meeting every 2 weeks to share information. And with Smart Start, we're doing a couple of things. We're convening all the statewide organizations who support childcare on just a standing twice-a-week phone call, so that we can troubleshoot, share information, coordinate our support, That's with the DHHS, the State Head Start Office, Child Care Resource and Referral, and our Child Care Health Consultant resource office at the state level. And then we're holding twice weekly video conferences with the Smart Start Network in entirety to hear, so we can share the updates that we know of and hear what's emerging and what issues are really cropping up in communities, what questions people have, and that's really serving as an excellent feedback loop to inform the state planning and to help us better serve communities. We're sending daily emails with updates and trying to package the information we're getting from several places. And every week, I think we're not going to need 2 meetings this week. We're not going to need the daily emails. And every week, we always have lots to share and to talk about. So I think I'll stop there.
No, Donna, that's great. That is great. I think hearing those very specific things that are being offered up is not only helpful, but can act as a guide for other states that are still sort of feeling around and determining what to do. Nasha, I'm going to step over to you, pass the baton to you, and can you affirm any of the similar things that you're doing and any things that Donna didn't mention that are specific to Louisiana?
Yeah, absolutely. So in Louisiana, we have been trying to think very carefully about how we spend the federal funds we receive to support childcare. There's a few things that we did from the start. We started to pay for enrollment instead of attendance pretty much the day schools closed, the day that the governor announced that schools would be closed. We started to pay for enrollment over attendance. We waived the family copay, so we're paying for every child at the sort of highest maximum state rate. And then at the beginning of this month, we issued 2 grants to all CCAP certified providers based on their licensed capacity. One to all providers to support sort of the additional costs of either staying open or reopening. And then one that was specifically for centers that had stayed open during this crisis. That was just specifically support the costs, the greater costs of emergency care, essentially. So we started with those 2 grants. We haven't made any promises, but we're hopeful that we'll be able to do another round of those grants in the future. We're also thinking about how we can do, so that's sort of like a broad, big approach. We're also thinking about how we can do a more targeted approach and potentially involve our version of Smart Start, which are community networks, how we can sort of leverage our local community structures to make sure that funds and supplies are getting to the places that need it the most. We're thinking about how we can leverage our state purchasing power to get the necessary supplies that are needed. So fingers crossed on that. We've started some work there, but we have seen the national news on how supply chains can get interrupted. So we're sort of keeping our fingers crossed on that working out. And then we're also thinking about infant toddler mental health and also the mental health of the staff who are providing care right now. So we have a long-standing relationship with Tulane University and their infant toddler mental health program, which provides consultations and coaching to centers during typical times that provide coaching to the directors, the teachers, the families, specifically around infant toddler mental health issues and supports for behavioral concerns. They have switched to doing teleconsultations during this pandemic, of course, but we've expanded their contract and they're expanding their consultations to include families as well during this pandemic, and are reaching sort of as many centers as they can, as many family childcare programs as they can, to provide support during what is obviously a very difficult time. Finally, we're thinking about how we can support the academic experiences of children. We know that it's not enough to just be considering childcare as babysitting. We know that what should be happening in these programs is quality, is continuing their learning, is sort of better than sitting in front of a television. So we're trying to think about how we can both make sure that programs have the supports they need to continue in their academic journey that they had started on, and that families who are keeping children at home because they can, are able to access the sort of many programs that have made their content available virtually for free. So we have created continuous learning guides, really birth through 12th grade. And we have built out sort of resources for families on how they can support their kids' learning, how they can build schedules for them, how they can add some activities. Really trying to think about that, that part of the experience that families and children are having. Moving forward, I would say that we are very focused on thinking about what it looks like to transition back to normal, or whatever normal will look like. And so we are thinking a lot about what a strong start to the next school year would look like, and how we can prepare our communities, our centers, our school systems to be ready for that, both in terms of like how they do it in a healthy and safe manner, how they support the workforce that will need to return, how they support families and children to feel safe to come back. And then also what good transitions in this time could look like. We know that lots of children have had different caregivers. This is obviously concerning at younger ages. And so thinking about how we can be supportive of those transitions, either to new centers or back to the care that they were in before, or potentially new classrooms, and how we can develop guidance to support that.
Thanks, Nasha. I appreciate it. And just, we'll go to Joy on the same question, and just giving the Smart Start team a heads up. What I want to do is, after Joy answers the questions, see if we have any questions that we can answer and be responsive to. So Joy, the response, taking into consideration what's been said already, what does Ohio look like, knowing that things are ever evolving?
So again, right now with the pandemic centers, whereas the families would come to us to apply for child care subsidies, they now go to the state. The state subsidized those centers at a 5-star rate. The state is also providing some payments to PFCC, publicly funded child care providers, that have had to close just to keep them afloat. But if I can, just really quick, as we talk about, providing good support for our centers, currently right now in Franklin County, 73% of our kids of color are not ready for kindergarten. So the new normal, as we talk about the new normal and providing support services, I would like to see that, there's an opportunity to look at this from an equity lens, particularly for our county. And I would encourage others out there to do the same. To go back to normal for us, I don't want to go back to normal, because what I know is, as we ease the restrictions for essential workers, many times Black and brown people make up the essential workers, hair salons, groceries, and all those types of industries that are needed. However, our centers are not opening to assist them so they can have quality childcare. So I would hope that our state would look at that as a support for our centers as well, in addition to providing PPE, the proper PPE equipment, in addition to ensuring that our families are safe and our children are safe by providing guidance on how do you social distance with little people, right? Like, what does that look like? And who's developing a model of what that look like? I think that we all around the country have an opportunity to collectively come together in our communities and send this, send our thoughts and our ideas forward to those who are going to be making decisions. So yeah, the state does provide that services, but again, for me, I'm really concerned, that we can, as we, providing support is one thing, but there's an opportunity, I think, to level the playing field from a more equitable lens.
So hold that thought, Director, because I'm going to come right back to you on quality and equity and go back through the panel on that issue, because we have an opportunity for what Donna said at the beginning. Heather, what are our attendees saying?
Well, we've got, so we're tracking 2 places for comments, both the chat and the Q&A section. The chat is filled with a lot of gratitude for all of you doing this today. So thank you so much for that. There are a couple questions that are very specific to sort of logistics in North Carolina. For those of you that have asked those questions, we're tracking those. We're going to hold off on those and follow up with you via email to give you very specific answers to those very specific questions. And I'm going to raise up some of the questions that are being asked that are pertaining to the broader conversation. So there are a couple questions relating to health and safety guidelines that are going to be needed to be put in place as we enter a phase of reopening in North Carolina. That has a lot to do with our child care health consultants. But a lot of the questions are around, how do we support increasing those measures, getting those guidelines in place, and also how do we get parents and teachers on a level understanding of what is required and what is necessary during this time, and so that we're all sort of operating from the same understanding of what that means now.
So, Donna, would you mind starting on that one?
Okay.
It's a lot to unpack there, but
yes, our child care health consulting, we have a North Carolina Child Care Health and Safety Resource Center at the UNC Chapel Hill University, is taking the lead for developing the health and safety guidance in partnership with DHHS. And they have been doing that all along for the emergency centers. And now as we are quickly moving toward a staged reopening, those guidelines are being revised as we speak. So once those are available, what they have done in the past is shared them out in writing and then held webinars with child care directors directly, as well as the Smart Start, Child Care Resource and Referral, others that are assisting centers, so that people can hear it, talk through it, ask questions. I think that is a great avenue. And then to take that further, the local partnerships have been touching base directly with directors on a regular basis and supporting them, answering questions, making sure that they are aware of the information, because the information is coming so fast and furious from so many different places. It's confusing and difficult for people to track it all, as while they're doing the important work of actually managing their centers and caring for children and interacting with the families. So I think the other thing that local partnerships have been doing is convening them as in groups, as well as the individual check-ins virtually in groups when those that are able to. And that has been extremely beneficial for the center staff, and allows the center staff then to be able to with more confidence share information with families.
Thanks, Donna. So I think what I'm hearing in not only the question, but in some of how the panelists have responded is, increased and enhanced and regular proactive and two-way communication with providers, answering questions. I think what we've also heard, at least from an ACS perspective, as we work with our clients across the country, is childcare providers are so hungry for the punch list. What do I need to do to make sure that I am ready for the transition to the new normal? And what does that mean for me? What does that mean for children? What does that mean for families, for the community, for public officials, for my budget? And right. So, Nasha, I'm going to pass the baton over to you and see if you can provide some reflections on that component of the transition to the transition, is what I'm calling it.
Yeah, on the health and safety part?
Yeah, or just more broadly, yes, the health and safety, but we know that sort of cascades into other issues. But yes, health and safety first.
Yeah, it's a good question, and one that we are, so I feel like the guidance on this is changing daily, basically. And so any answer that I give you right now, because We are the Department of Education. We are not pretending to be the public health experts in this at all. We are following the public health experts' guidance. As they learn more, their sort of recommendations have changed. We've committed to being as sort of proactive to the field as possible. So when schools closed that weekend, we started having webinars with our field, and we continued them every couple of days, and then we changed them to weekly. And we'll continue to do that, especially as like the phased reopening starts, because we want to make sure that our field is hearing directly from us, and there isn't sort of like the rumors or the, you know, interpretations of things or anything like that. And we want to make sure that as we are getting questions from centers, we're directing them sort of in a positive, proactive way to our Office of Public Health at our Department of Health, and then sort of getting the answers and giving them back to the field. But at this time, we are working on center reopening guidance that is focused on information we've received from our collaboration with the Office of Public Health. I think everyone knows that childcare is a critical part of any reopening strategy, right? So there's definite desire to get this right. At the same time, there's a lot about young children being around older caregivers in centers day in and day out that's complicated to navigate. And so we're all sort of trying to strike the balance and make sure that we are providing, you know, sort of both the requirements and being clear and explicit about what the requirements are to reopen, as well as guidance and being explicit about the difference between the two. And supporting all of that with resources, PPE, sample protocols, different things like that.
Thank you, Nasha. It is, and it's an overused analogy, but it truly is building the plane while it's flying. But I think what the common thread among all of you and many of with whom we work around the country are trying to be as proactive as possible to get the information out, get responses, and be responsive to what people need. So Director Bivens, any additional thoughts on that? But I also want to pose the question to you around, you know, we've always struggled with the childcare desert issue. And now that inequity is even more enhanced or elevated, so where is the opportunity there, especially when it comes to communities of color, tribal nations, immigrant populations? I know everyone on this panel has had in-depth experience in one way or another with these. So Joy, if you can just talk about the health and safety piece first, how you are assisting providers in navigating that wild west of reopening, and then on the equity side.
Right. So I may have to ask you the second question again, because it comes to me real fast and then leaves me real fast these days, because we're like, you know what I mean?
I should know that.
I think some of the guidance that we're hearing from the state is 1 in 4 for infants, 1 in 6 for toddlers, of course, trying to keep, you know, if you have parents within the, in your center that work at the same organization, trying to keep those same children and families, you know, in that same room or in that same vicinity, restricting when parents are coming in and coming out, ensuring as much as possible you have the same staff working with the exact same young people or children every day. As it relates to equity, I think one of the things that our country and our communities do is we study each other, and we have so much that we love data, right? Like, we just love it. We love quoted. I love it. I love saying 20% of this and 40% of that, and, you know, flipping it and counting it. But one of the things I think that we could do is, particularly for deserts and those communities that are underserved, is leverage that data to those who are being impacted, educate them on, you know, the 73% or the 42% of your community or your centers will not be open, so that they can take it to those who are advocating in their community, their legislators, their state representatives, or city council people. Because what will happen is, as we know, is we will perpetuate a cycle of generational poverty within these communities. And this is going to set us back in all of these disparate communities going forward. So I think if anything, I think that we need to raise these issues to those who are making decisions from the federal level to the state level to the local level as we're developing these stimulus packages to ensure there are enough resources in those packages so that these communities will have the resources that they need for their early childhood centers. We also need to ensure that those who are utilizing early childhood services, such as parents in these communities, underserviced, we need to make sure they're at the table when decisions are being made. We're not making decisions for them, educating them on the importance of the why they need to be involved so that they can always advocate for resources in this community. Because again, if we miss this opportunity, we're going to set children back another 10 years in these minority communities and poor communities.
So Director Bivens, I'm going to follow up on that. I'm going to jump into your brain a little bit because I know you've been having some of these questions. You know, the Director Bivens works for 3 county commissioners, so they're her bosses, and I know she's been having some of these policy conversations. Give us insight into what conversations you're having with them around those policy opportunities.
Well, one of the things, you know, we're working with our local providers. So I will give a huge shout out to Future Ready, Action for Children. These are our, you know, our R&Rs and our think tank organizations that really work in this space. I am not the, you know, this is not my day-to-day work. I think I'm an early childhood provider just because I'm a mama, but that does not make me all things, right? So one of the things that I'm having, again, just with them is, you know, the conversation about equity and ensuring that we're raising the voice for the community as we're making decisions on funding. The other thing is, you know, we're putting out to our team as we're talking to the state on curriculum as we begin to reopen, ensuring that the curriculum does not diminish because of the COVID, that these children have the same standard of education going forward as if they would if there was not pre-COVID, if there was post-COVID. So just having some of those conversations, again, looking at everything from an equitable lens and utilizing data to support it. Because if an affluent community children is on par pre and post COVID, then a non-fluent community should have the same standard. Your zip code should not dictate your future, especially in education.
Mm-hmm. Absolutely. Thank you, Director. Nasha, do you want to dovetail on that at all with regard to the maintenance of quality, equity, childcare deserts? Talk to us a little bit about what you're doing in Louisiana.
Yeah, I mean, that's such a complicated question because Louisiana is both a really poor and rural state. So we have a number of childcare deserts. We also have similar equity issues. And I think the thing that we are thinking about is how do we get back to the academic strategy that we had before? And how do we let this deter us from what we were trying to accomplish? We have to change certain parts of this, absolutely. But it's unacceptable that kids would get to 3rd grade and not be able to read as a result of any and all disruptions. And we have to sort of stay on track with our academic strategy to achieve 3rd grade literacy and for kids to have the experiences in early childhood, in pre-K, in K1 and 2 that they frankly deserve to have. So we're being as thoughtful as we can about how we do that, how we push our school systems to do that, how we push our vendors to help make sure that their resources are helping to achieve that. You know, it's unfair to put this burden just on teachers who have to like create things in their homes or like pull things from Pinterest or other places. Like that can't be the answer. We can't be hodgepodging this. We need the folks at the systems level in the vendors who are being paid to create this content to really be leading the way and equipping our teachers who are going to come back to classrooms, back to schools that look very different than they did before, with what they need to ultimately be successful and come back to the strategy that we have been working so hard to develop and implement over time. So I don't know that fully answers your question. I'm not sure that we fully have an answer yet. But that's sort of the direction and the goal that we have at this time.
So Nasha, just a quick follow-up, since you are sitting at a statewide level, how do you balance from as you transition to the new normal, how do you balance making sure providers have the basics, health and safety, proper ratios, with the quality piece, with maintaining the fact that we don't want to see that slide that Director talked about?
Yeah, I think so. A big part of what we've done specifically in early childhood, I won't sort of talk about the pre-K-12 space as much, but specifically in early childhood, we have really invested in our directors and in our workforce through our grading system. That has been our goal since 2012, but a lot of our work since 2015. And in creating sort of capacity at the local level around the importance of high quality interactions, the importance of teachers in classrooms who know and understand how to talk to, interact with children. I think that's going to be more important than ever before, considering just the trauma that all of these children are going through. So for us, it's going to be, how do we retain the teachers that we've already trained, that we've already been observing, that we've already sort of invested in building to a certain level of quality? B, how do we ensure that everybody who's coming back into centers as workforce are getting refreshers on what high quality adult-child interactions are, on how they can use their curriculum to supplement that, on how they can know and understand where each kid is and how they can support them through every interaction they have to help them achieve kindergarten readiness by the end of their experiences. And then the third thing is making sure that we are helping our directors be the instructional leaders that they have been on the track to becoming, right, over the past few years. And many of them are and are sort of like community leaders in that space. But when a pandemic like this hits, they shift from being instructional leaders to how do I keep my business open and my doors open? And so how we are thinking about how we help provide supports and resources, and how we set our communities up to be helpful in providing supports and resources. In a lot of places, this is our school system, right? How we say to our school systems, look, these children are going to come to you in kindergarten. What can you do to help make sure that we, once we get to reopen, there is an order of operations here. First, we need centers to reopen. We need directors to be made whole. We need teachers to be able to come back to work. We need everybody to be able to do that in a healthy and safe way. I'm not sort of discounting all of that. And I think that is like critical phase one, it's an all hands situation there. But I think once we get to, okay, we've gotten back to our capacity that we need to, how can we make sure that we are being supportive of everybody who's coming back into that building to get back to what they were doing with children before, with an increased understanding of trauma-informed care, with the supports from our infantile or mental health consultation programs, with coaching from CCR and ours that is sort of targeted towards what teachers and children will need following this pandemic. I don't know if that's your question, but that's sort of how we're thinking about it.
That makes me so happy, Nasha. I mean, you outlined 3 very specific things. So workforce capacity, the professional development to maintain the quality, and then promoting and supporting your instructional leaders. Because I'm going to tie it to something someone said in the chat box, because we all need to learn how to adapt to new environments and circumstances. That seems to be likely the most challenging step immediately after the health and safety component. So the potentially fourth piece, I wanted Director Bivens to, is what Franklin County is offering to childcare providers and staff, and has been, but feels like you had a crystal ball a few years ago, Director, in what you established, because now it's even more important. Can you talk about that very specific offering?
So currently right now, for when Step Up to Quality came into play, and I'm going to fudge the numbers. I think that, we were at 24% of our centers being star rated or quality rated. We have offered online training. We've offered in-person training. We have modules to assist staff and directors in assisting their center becoming star rated. So over the last several months or last few years, we've gone from 24%. I think we're probably at 79%. And is that number right? 79%, just to ensure that our centers become star rated. And we did that as an agency because 27,000 children in Franklin County receive publicly funded childcare. 68% of those children, had we not done that, would have lost their child care, would not been able to be in an opportunity to be in a quality center. So 68% of children of color, I apologize. So I'm being corrected. We're at 82% now. So we've developed a curriculum to assist center owners, center directors, staff, to assist them in becoming star rated. So we get them to the front door because the state has to, of course, standardize and qualify them. Our online training, it has skyrocketed. We've trained nearly 500 providers over this course of doing this for the last couple of years. And it has done very well for our providers. They're very appreciative. And had we not done that, we probably would still be at the 23%. If I can touch on something really also, Scarlett, we're working with the providers, but we're also working with partners like Future Ready and our R&R Action for Children. But one of the other things we did was when we looked at the landscape of Franklin County, many times it was the mom dealing with the provider or the center, and people assumed that dads were not involved, particularly men of color. So we partner with the African American Wellness Walk organization, National Association of Urban Scholars, who they do a large African American Wellness Walk for men every year. And we launched a program called Calling All Dads. And we have dads now reading online to their children. They are talking to their centers about quality and what it means to be quality. They have a campaign or a pledge that they sign for dads to be involved in their child's early learning career. So that is another thing that we've done. And that I was driving down the street the other day and I saw a billboard. And I think there's like bracelets and all types of stuff that these dads are doing to ensure that their children are in quality star rated centers and that they're engaged with the work at the table, which is really, which has been phenomenal. So again, we did a social media campaign when we were not hitting the numbers of being quality. We did radio ads. We did everything we could to ensure that the families and the centers, we did commercials. This was not subsidized by the state. This is money that came out of our county budget so that we could fund. I went to the commissioners, asked if we can fund this so that families were aware and providers were aware what was at stake had they not become quality rated.
Again, thank you. Your response really drives the continued thread from all the panelists that, yes, it's about responding on the basic health and safety, but maintaining quality professional development, instructional leaders, workforce capacity, and the family unit. And for you, Director, specifically fathers, which in a time where right now we're quarantined, even more important to have that type of strategy being implemented. Donna, I'm going to shift over to you. Any additional thoughts on the maintenance of quality before I shift to sort of our next set of questions?
I think I really appreciate, Nasha, what your comments about quality and especially the trauma impact and supporting the center staff and the home staff to be able to respond with a trauma-informed practice. And that is an area that in North Carolina we had begun to work on and have for several years been moving in that direction. And we're going to have to ramp that up, obviously, as we move forward. I do want to go back, if I may, to the issue that was raised around deserts, and because we are a very rural state, 80% of our state is rural. And one of the concerns that we have is that, especially for infants and toddlers, we are mostly a desert state. And with so many of the child care programs closing, the ones who are most viable may not be, as you were mentioning, Joy, where we need them to be. They may not be in the communities, in the rural communities, and in the parts of urban communities where families of color live and work. And so using an equity lens and being able to get some good information about the supply and demand that's truly based on what families need, that's a critical challenge that I see before us. And as we've, with my partners, and I'm so fortunate to have such great, smart, and dedicated partners in North Carolina, as we're beginning to talk about planning to move forward, trying to figure out how we can do that sort of statewide landscape analysis. So as we're helping centers reopen, that we're doing it strategically with that equity lens, because otherwise it's just going to be happenstance based on who can figure out or already has the viability to open. And then we would be able to deploy some site-specific assistance and coaching around the business aspects as well as the quality aspects.
Thanks, Donna. I think a lot of people, even within the childcare space, tend to forget that providers are small business owners, mm-hmm. and those small business owners have an economic impact on not only their local community, but they take care of the kids whose parents are the workforce.
Right.
So on the economic impact side, but also on the, if you weren't paying attention to childcare deserts or equity before this, it's going to be a stark shock to the system moving forward. And with that, I know we've had a couple of questions around tough to engage communities or historically marginalized communities. This is something that has come up certainly for all of you, but also in our work around the country when it came to federal grant work that some states were working on over the past few years. And we've talked a lot about how do you engage communities like tribal nations, large populations of immigrant communities. I'm just going to ask all the panelists this, if you have the opportunity to talk about either a particular community that's been traditionally tough to engage that you've had success with, or even if you haven't had success, how? Remember, how are you specifically engaging those traditionally either marginalized communities or tough to engage communities for either cultural or historical reasons?
Can I start, Scarlett?
Please.
So one of the populations that we understood in Franklin County was our Somali population. We wanted to make sure, because when the curriculum, the new standards came out, it was written in English. And I think that, again, looking at an equity lens, we need to understand that when these policies and new things come out, that, there's other people that live in the world other than us, and we need to make sure that there's curriculum that goes across a broad scope. So what we did was we looked to find who were the community influencers within that community that could assist us in engaging the providers and the family so that we could educate them on the importance of being a star rated or a quality care center. And we did that through, again, trying to identify who were those community influencers. And many times what you found was there was not just one, there were several. So also looking at, the state unfortunately did not provide us with resources to, I believe that the dollar amount for us to translate the curriculum for the professional development training was like $20,000 or $40,000. So I went to the commissioners and said, we really got to make sure that, we get this done. So right now we're looking, it's in play right now for the curriculum to be translated into Somali so that, you know, again, thinking of equity, so that they have an opportunity to be successful in this quality star rated system. So again, I think looking at who's in your community, who are those social influencers, how do you leverage those social influencers so that they can assist their community and demographic in being strengthened in this landscape?
Thanks, Director. Nasha, any thoughts from a Louisiana perspective?
Yeah, and again, at the state level, I think this looks a little different. I think for us, there's both the state level sort of aggregate data that we can look at and see sort of across our state where our biggest concerns are and how we can sort of help and support there. But also, how do we empower our CCR&Rs and our community networks to be really thoughtful about this? And how do we make sure we're providing them with the sort of targeted supports that they need? We know that we can't treat, you know, New Orleans the same as we would Madison Parish. And that's like a really critical part of our approach. But I think that similarly, we can't act like we in Baton Rouge can go out and solve all of these problems for the entire state. There needs to be sort of community leadership, both at like the parish and the regional level. And we have to sort of be facilitators and people who would sort of empower, but also people who put together guidance and supports and resources to help make that happen and be real thought partners for our folks on the ground. So I think it looks a little different at the state level, but I think it's not any less of an important consideration, if that makes sense.
Absolutely. And this is the delightfulness of this panel, that the state perspective, if the state is able to facilitate, provide thought leadership, provide a framework for best practices, and then, as Director Bivens indicated, the locals are going to know, local communities, whether it's regions or cities or small townships, they're going to know who those key social influencers that's most appropriate. So absolutely. And Donna, could you round that out for us from a North Carolina perspective? And by the way, I mean, yes, it's immigrant populations, but I think what we experienced when we did some knee-deep work in Arizona is that sometimes it's geographical barriers that are a challenge. Sometimes, you know, comparisons of rural versus urban access and engagement. So it doesn't have to be limited to a certain set of tough to engage audiences. It could be much broader than that. So yeah. Donna.
Yeah, thank you. You know, I agree with Nasha that it's the community, and Joy, you know, it's the communities who have the knowledge of who's living in the community. So our local Smart Start partnerships are really our primary leaders in the ability to engage and learn who are the community leaders from the different groups. And start listening. I think that fundamentally is at the core of so much in understanding cultural differences and needs. And that's where then the communities are able to be really innovative in thinking about what's needed and within the parameters, the constraints that we have, how best to use those resources. And the local partnerships in North Carolina have been really creative in working with childcare centers and helping to compensation. We haven't talked much about compensation. I want to raise that up here, because if we can't improve compensation for this workforce, what marginalized community wants to even open this business and work in this business? I just think that I want to put that on the table as such a core issue, and we are working on that in North Carolina, but have a long ways to go, and welcome ideas from others. I do think we need a big national scaled effort on that. So I just wanted to put a plug in for that. but to get back, I really do think that the community-based approaches are where we will learn the most and be able to bring that and share it more statewide.
Absolutely. So
Scarlett, can I just jump in really quick? I'm sorry.
Yeah, go ahead.
As we're talking about reaching some of these marginalized communities, one of the things, again, that we did in Franklin County was, you know, we went to the community, but also we brought in the business community. We just didn't leverage it. We didn't say, okay, provider, it's just on you to figure out how we get this done, or, you know, whatever. We brought in the business community to ensure they were educated as well, because they have, you know, employees walking through their doors every day. And it's an opportunity for them to be educated on the importance of, hey, if these centers aren't star rated, these families can't come to work, and that's going to impact your bottom line. So it will behoove you to ensure that you're up to scale on this as well, on a broad scale of all the community partners you have and families, whether it be Somali, Hispanic, Black, white, whoever. So we made sure that our workforce was involved in this as well.
Thanks, Joy. And just a follow-up on that, I know that what we've experienced when we talk to state or regional early childhood efforts around the country, starting the conversation with a chamber of commerce or the business community sometimes is very intimidating. Talk to a little bit about how you started that conversation.
So one of the things, of course, I have to go to my commissioners. So I'm trying to be on good behavior today, Ms. Donna, so that I have a job later. My son it just finished his freshman year at North Carolina A&T. So I have to continue to keep my job until for the at least next 3 years. So I'm on good behavior today, Ms. Donna. One of the things that I did was I went to my commissioners first, but you know, ignorance is bliss. I don't know what I don't know. And basically I spoke their language. They don't know about, you know, childcare ratios, and it's no longer called daycare center anymore. It's early childhood. I spoke their language and was real practical and just real. If July 1st, 2020 was today, that was the deadline. And these centers cannot operate because they do not have a publicly funded childcare agreement no longer, because again, only 24% was represented. Your employees are not coming to work. Do you know what that means to you? That means your widgets will not get processed. That means whatever, you know, your deliveries will not be made. And that's going to impact your bottom line. So whether you care about kids or not, I know you care about your money. So you really want to make sure that you are a part of the solution versus waiting for someone to develop the solution after your business closes. And again, ignorance is bliss, so I didn't know any better than to say it that way.
It's perfect.
Donna, what's your follow-up on that?
I just say that's perfect. I mean, we all know the childcare system is going to be fundamental to rebuilding our economy, and that's, Joy, a brilliant way to help people really see the impact. So it's not just talking theoretically, but you know, you could close if you can't get parents that can come to work for you because they don't have anywhere to safely leave their children during the day and be able to focus on their work, because they have the peace of mind to know that their children are not only safe, but they're in a high quality early learning program.
And Donna, I did want to come back to you after you initially raised up the issue of compensation. How do you talk about that when, I know in Ohio, our governor announced yesterday that the upcoming budget right at this moment, and it's not going to get better, is looking at a $775 million cut. And that will trickle down to the local communities. So what are you thinking about? You might not have the answer, which is okay. How should we be thinking about talking about compensation in what is going to be an apocalyptic budget process for any community moving forward?
Yeah. I think we can't, I mean, obviously the recession impact is real. And at the same time, we cannot shelve this need and wait until we're in a better situation. So I think we have to continue to raise public awareness, including parental awareness. And I think, you know, unfortunately, this crisis will help with that. If parents are looking to go back to work and can't find care, it's going to hit people in the face, and it's going to hit employers in the face. So it's an opportune time for us to pair that with who wants to go into this profession. If you're only going to make an average of $10.50 an hour in North Carolina, so I think we have a prime opportunity to build public awareness and continue, and assuming that the need for childcare is going to grow more gradually as businesses gradually open, and so many people are out of work, that it's an opportunity for us to plan and put some more sustainable systems in place, even if it's on more of a pilot approach that we could scale later, but to use this as an opportunity as we rebuild to rebuild with some better salaries.
Absolutely. So continuing that consistent, regular two-way communication about a ton of things, and it seems overwhelming, but absolutely including compensation. I'm just going to pause for a second because I want to pivot to Heather, just to make sure we're staying on point.
Yeah, so lots of woohoos and amens to many of the things that you all are saying, so thank you so much. And we have a lot of questions coming in. For those of you that have questions that we aren't able to get to today, I promise that the team behind the scenes is tracking on all of these, and we will get you a follow-up in some way. One question that was raised up that was touched on a little bit and sort of encompasses all of the things that we've talked about is, can you share any efforts at the state or national level to provide guidance to support transitions that acknowledge the level of stress that directors, teachers, parents, and children have experienced? Hoping someone has focused on supporting reconnection and trust building between teachers and parents and directors.
Wow, that's a great question. And anyone on the panel want to take a first shot at that?
And just so I can clarify, is that post-COVID? Is that just all around general? Because I know one of the things that we do is we have a social emotional partner that we work with through our Family First Council to assist providers and families in social emotional learning and healing and those types of things. Our partner also, Future Ready, is doing some work in that space as well, because we recognize it to be real and very important.
The question doesn't specify, but I would take it to mean that it's kind of as we all start coming back together, the trauma and the stress that has layered on as we all went through this together, how do we make sure that we're acknowledging that in a very intentional way?
Yeah, I think we're working with our partners to figure out what that looks like. Particularly, you know, again, we've never been here before. You know, this is a 50-year thing. So I think one of the things we're doing is trying to work with our partners to ensure that they are funded and prepared to be dispatched in order to resource these providers in those areas.
Thanks, Director. Heather, anything else coming your way?
We have a question about, in addition to the compensation, is there any thought on higher education for the workforce, and how do we layer those strategies into rebuilding as well?
I would say we connect the salary scale with education requirements so that they go hand in hand.
In Louisiana, we have a set of school readiness tax credits that staff and childcare centers can access. And one of the things that we've worked really hard to do is build a childcare credential called the Early Childhood Ancillary Certificate. And if childcare teachers earn that credential and then stay in the field for multiple years, they can get to the highest level of tax credit, which is $3,300 annually that is refunded to them when they file their taxes. it's a fully refundable tax credit. And we've had a lot of benefit with that. It's not perfect because it does take sort of working in the field for a year before you can file for it to supplement wages, but it has been beneficial and a way for us to invest in childcare salaries. So definitely one of the things that we'll be thinking about is, how do we get our ECAC programs involved in recovery so that teachers are, again, prepared to do the work that they'll need to do to support children when they come back to classrooms, but also B, how do we make sure as many teachers as possible are taking advantage of that tax credit in a year where they're going to need those funds.
Thanks, Nasha. That's great. And I think what our observation is that those types of benefits must be preserved moving forward. They can't be forgotten, because going back to what you said earlier around building the capacity of the workforce, the quality of the workforce, building instructional leaders, we cannot forget those things. As we've been saying as a firm, we have to have one eye on the response, but absolutely one eye on recovery, and recovery in a very comprehensive way. So I'm just looking at the clock now. We have about 9 minutes left, and I do want to kick it back to Heather and Donna for a wrap up. But final thoughts from each panelist, and the way I would like to frame this is, everyone is drinking out of a fire hose right now and trying to do everything that we think needs to be done. We're checking that list. But what are you thinking of? Well, I'll say this. I heard many times from many people over the past few weeks that recovery is not going to be short term. Building the new normal is not going to be short term. So what are you thinking of from your perch on the recovery side of things? How are you looking at the future and getting prepared for it? So, Donna.
I mentioned earlier planning with our partners, planning to plan, if you will, and wanting to have an inclusive planning process that would include business and economic development, childcare programs, families, and of course government and philanthropy to come together and develop a shared vision and a blueprint of, and we need to start this now, and for that we can really use as we move to rebuild, and recognizing that we won't have it together, we won't have it finished in 2 years, but if we have that shared vision, we can be so much more clear about the interim steps that we take and make sure that they are leading us to where we're trying to get to, and that we're all working collectively to, even in our different aspects of work, to get to the same point, regardless of how long it takes. Louise Stoney has been such a thought leader with Opportunities Exchange, and and her voice has been very loud, thank goodness, recently. And she lifts up so many different ideas that we need to be exploring. I think there's a lot of merit there, and how we better support family home providers, and technology. Our childcare programs probably seem like the businesses that have the least technology, just about of any business. So there's so much work to do, but coming together and getting agreement about where we're trying to get to, and then, okay, what do we do next? What's our highest priority over the next 6 months, then the next year, and gradually build it.
Thanks, Donna. So inclusive planning and being strategic, and pushing.
Yes.
Nasha.
I would echo both those things, right? Inclusive planning and being strategic, I think, is really important. I also think it's really critical at the state level I'm kind of being repetitive, but to create the framework or guidance around the priorities and like being the people who are sort of setting the tone for the conversation while allowing flexibility for local leaders to lead based on their context. And so that is really a critical part of our focus. And to be sort of the forward looking leaders, right? There is a lot of reactive right now, and that is important. And people have been living in reactive for a little while. And I think we view ourselves as the folks who have to help people see the way out of reactive and towards sort of proactive planning and moving forward.
See the way out of
and
reactive.
Towards economic recovery, obviously.
That's awesome, Nasha. Seeing the way out of reactive. I love that, and I'm going to steal it and use it. Director Bivens, we got 1 more minute before I send it over to Heather.
So just really quick, my concern is the most vulnerable, and one of the things that I believe my job is to rally everyone to the cause. Do not shut anyone out. Use the business community, nonprofit community, use our faith community. Many times we only call on them when there is a crisis or when unfortunately someone passes. They have influence. Bring them to the table. Bring everyone you can possibly bring to the table to be your megaphone so that we can advocate for resources for our families and young children. Thank you. And also, really quick, equity. Going forward, equity is going to be my big thing, because again, this has highlighted for COVID, all it's done is highlighted the disparity issues that have existed for several years. Now we have an opportunity to change a trajectory for those who have always pinged low in those categories where they should have been pinging high. Thank you.
Thanks, Director. And Heather, I'm quickly passing the baton back your way.
Oh, thank you all so much. I am feeling hopeful and inspired, and I am grateful to all of our panelists and to you, Scarlett, for moderating. If we can all just virtually give them all a big round of applause. I also want to make sure that we thank our conference sponsors that were able to still sponsor this conference for us, even though we went virtually. That's Kaplan, Lakeshore, the Simula Foundation, and All About Books. And again, thank you, Donna, Nasha, Joy, Scarlett. We are grateful for your expertise. We are grateful that you all are leading the way through this. So if everyone can just give a big thank you to everyone. And also, as we all log off, all nearly 600 of us, let's give a big cheer for the early childhood workforce that is working so hard out there right now. Thank you all. Have a great day.